bird's-eye view of the medical world, Part 12. Ayurveda education should be imparted by leveraging the concept of countrywide classrooms or via the internet, at least in terms of teaching the texts and scriptures. Colleges should focus solely on practical training. In the evenings, students should ideally work as an understudy or intern with a doctor. This can help make a big difference in the current scenario. Since the very nature of this profession involves a lot of practical work and interpersonal interaction, having relevant experience is priceless. Unfortunately, there is a negligible number of patients in medical institutes and associated hospitals. Or these institutions only follow allopathic practices, which leads to students in these colleges gaining no real knowledge or practical exposure. If we want this to change, we must turn to the suggested model of learning. Textbook knowledge can be imparted through the internet or satellite. And if Ayurveda's practical knowledge can be learned locally, it will deliver great benefits to the profession and clinical practices. When our teacher graduated in the year 1962 and decided to pursue Ayurveda as his profession, there was a very limited number of such professionals around at the time. Even the patients who sought their advice were primarily complaining about traditional disorders such as arthritis or acid bile reflux. Difficult or complex cases were rare to come by. The world was smitten by the idea of symptomatic relief or temporary relief, a concept propagated by modern medicine. Eventually, this became the norm. When people came to know about viral infections or the fact that infections can cause fever, their perspective towards the concept of fever changed completely. This was also the time when antibiotics had become a strong weapon in the world of medicine. The attitude was that you could eat whatever you wanted and simply take antibiotics for immediate relief from health issues. The emergence of steroids, similarly, proved to provide immediate relief to asthma patients. Progress in anesthesia also ensured that big surgeries could now happen easily. Addressing heart diseases with surgery, angioplasty, valve replacement, knee replacement, etc. was made possible due to the developments in medical science. However, this resulted in a gap being created between society and Ayurveda. When the hollowness of this system was subsequently realized, people began turning to Ayurveda as an alternative form of treatment.